I just wanted to say about Aniruddha that I know a lot of people have been very interested to meet him, in particular that it's a rare opportunity to meet someone coming from so far away.
So I happen to be an IVF specialist, but I actually think of myself as a little bit more than that. And I think of myself as being a patient advocate. And in reality, every doctor is much more than just a medical professional. You know, the only reason we do medicine is to talk for our patients. As an IVF specialist, when I started 25 years ago, it was very hard to tell Indian patients what IVF was all about. And it would spend a lot of my time explaining what eggs and sperms are. So we created animated cartoons in order to explain to patients what we were doing. We then moved on to using e-learning courses. And then we created an IVF comic book. And what we found is that women, when they're going through IVF treatment, are highly motivated, but their husbands were pretty clueless. But once we created the comic book, even while they were waiting in the clinic, they'd be happy to go through it and find out what was happening. And I think the point is that every doctor needs to be a teacher. He needs to be a patient educator. And I think this was my next step, is that you move on from being an IVF specialist to being an information therapy specialist. Someone who educates patients because it's good for the patients and it's actually good for me. So we created an app which is called the My Fertility Diary, which actually helps patients to track what's happening to them during the IVF cycle. We said, why are we restricting ourselves to IVF? So why don't we create an app to educate all possible patients so that doctors can use these kind of tools in order to help their patients? And we then created a clinical decision support system, which is different because it actually helps patients to make sense of what their blood test results are. And it allows them to integrate the medical information instead of depending only on their doctor to do it. Therefore, we then said, how can we make sure that patients are the ones who need to do most of the work, because doctors are always going to be very busy and they're never going to be enough doctors, so that we actually start creating tools so that patients could make sense of their medical reports for themselves, or when they do a PubMed search, they can understand some of the medical jargon. I then finally realized it's not possible for me to do everything. And therefore now, this is my third avatar. I'm now an angel investor. So you start from an IVF specialist to an information therapy specialist to an investor, so that now I can invest in startups who can scale this up and make it sustainable in a far better fashion than what I would ever be able to do it. So one of these companies is called Avaz app, which actually creates apps for autistic children. And there's another one which creates patient education videos in 8 regional languages in animated cartoon format for Indian patients. And I think there are some lessons which I have learned. My journey has never been a straight line. It's been all over the place. You find out what your patients need, and then you try to create a solution for them. And I think it's so important that conferences like these engage with doctors, because doctors can actually be extremely powerful. They have a lot of influence as to what patients do and what other doctors do. And they actually have a lot of insights, and they can actually contribute to the innovation. And we need to get more doctors involved. And the reason I love this conference, Denise, is that normally when you attend a medical conference, doctors are keeping on complaining and griping about, how bad life is and how no one respects doctors anymore. And in a conference like this, there's so much optimism and hope for the future as to what the future will hold. And the one thing I would definitely like to say is, I think you must understand that India is really going to become the digital healthcare innovation hub for the future. You have 1.2 billion patients. You have such a huge market within India itself. You have so many doctors, all of whom are extremely qualified, speak English fairly fluently and can manage. You have technology, you have lots of clever developers who can do stuff. So a lot of the stuff I did, I used local Indian developers, and I could do it at 1/10 of the cost of what an American physician, for example, could do. But I will also say one thing. India can teach you what I call frugal innovation. Because we are a developing country, we have so many constraints, we have to make sure that we get the biggest bang for the buck. And finally, if you can succeed in a market like India with so many constraints, I think there is no reason why you can't succeed in any possible market anywhere in the world. So this time, Denise, there's been only one Indian from India in this conference, and I'm hoping we'll be able to get more participation for the future as well. Thank you.